So good morning. So let us start with this mixed bag MCQs. We have got MCQs as well as visuals for you today. So I am Dr. Pradeep Pawar, Professor of Anatomy, having a vast experience of teaching anatomy for the undergraduates and the postgraduates, especially the entrance examinations, India and abroad. Okay, we'll begin. Students, now have a look at this first MCQ. Answer this. Yes, any guesses? A 20-year-old male was involved in a fight. During the fight, he received a deep knife wound in front of his right thigh. On examination, it was inferred that the knife point had severed the trunk of right femoral nerve just below the inguinal ligament. Okay, so that's the femoral nerve which is involved. So before we start with this, students, femoral nerve, can you quickly tell me this femoral nerve is a branch of what plexus? Femoral nerve. Come on, be interactive, answer. Femoral nerve is a branch of lumbar plexus. And what is the root value of femoral nerve? The root value of femoral nerve is the dorsal divisions of the ventral rami of L2, L3, L4. Correct? The dorsal divisions of the ventral rami of L2, L3, L4. That's femoral nerve. Now this femoral nerve lies in a groove between two muscles. The femoral nerve lies in a groove between two muscles. What is that groove known as? The iliopsoas groove. It lies in the iliopsoas groove. Tell me, what is the relation of femoral nerve with the femoral sheath? Yes, anyone? What is the relation of femoral nerve with the femoral sheath? It lies inside the femoral sheath or does it lie outside the femoral sheath? Femoral nerve. What is its relation to the femoral sheath? Come on students, be interactive, answer this. It lies outside the femoral sheath. The femoral nerve is outside the femoral sheath. If you just have a look at the femoral sheath like this, there are three compartments, correct, for the femoral sheath. This is the lateral, this is the intermediate, and that's the medial compartment. What is present in the lateral compartment? The femoral artery plus, yes, femoral artery plus the femoral branch of genitofemoral nerve. That's the femoral sheath whose lateral compartment is occupied by the femoral artery and the femoral branch of genitofemoral nerve. In the intermediate compartment is what? Femoral vein. Intermediate compartment is the femoral vein. And the medial compartment of the femoral sheath is empty. What is this known as? Femoral canal. This is an empty space. That's the femoral canal. So the femoral nerve does not lie inside the femoral sheath. Remember that. It is outside the femoral sheath. It lies outside the femoral sheath. Correct? Okay. Now this femoral nerve comes below the inguinal ligament and then it has got, yes, quickly tell me, what is this for the femoral nerve? That's the main trunk of the femoral nerve and these are the two divisions of the femoral nerve. This is the anterior division and that's the posterior division. Anterior and posterior divisions of femoral nerve. What is this? That's the trunk of femoral nerve. This femoral nerve is extremely important, students. Trunk, anterior and posterior division. Femoral nerve lies outside the femoral sheath. Okay. Yes, okay. Right. What are the branches and who's going to divide this femoral nerve into two divisions? Can anyone guess this? The femoral nerve is divided into an anterior and posterior division by whom? Yes, any guesses? There's an artery. There's an artery which divides the femoral nerve and that artery is the lateral circumflex femoral artery. The lateral circumflex femoral artery is the one which divides the femoral nerve into an anterior and a posterior divisions. Okay, that's the lateral circumflex femoral artery. Now, what are the branches from the trunk of the femoral nerve? Students, this is a very easy way to understand the femoral nerve. Branches from the trunk. One is nerve to iliacus, and the second one is nerve to pectineus. Nerve to pectineus. Now, which half of pectineus is it? Lateral half. So, what are the branches from the trunk of the femoral nerve? One is nerve to iliacus and the second one is nerve to pectineus. The anterior division gives it gives one muscular branch, and two cutaneous branch. Anterior division gives one muscular and two cutaneous branches. Muscular branch is given to what? Sartorius. Muscular branch is given to sartorius. And the cutaneous branches are what? Medial and anterior cutaneous nerves of thigh. The medial cutaneous nerve thigh and the anterior cutaneous nerve thigh. So these are branches of anterior division of femoral nerve. Perfect, students, perfect. Now the posterior division gives two sets of branches. It gives four muscular and one cutaneous branch. Four muscular and one cutaneous branch. Four muscular branches to vastus medialis, vastus lateralis, vastus intermedius and rectus femoris, together known as quadriceps femoris. So vastus medialis, vastus lateralis, vastus intermedius and rectus femoris, and one cutaneous branch. What do you call this as? Saphenous nerve. So that's the saphenous nerve. Clear to all of you? So that's how you understand the femoral nerve. Any doubts, students? Any doubts in this? So femoral nerve का main trunk है, दो divisions है, anterior, posterior. What are the branches from the trunk? That's nerve to iliacus, nerve to pectineus. Anterior division gives one muscular, two cutaneous branches. Muscular branch is given to sartorius, cutaneous, anterior, and the medial cutaneous nerve thigh. Posterior division gives four muscular and one cutaneous. Muscular branches to quadriceps. Cutaneous branch is known as the saphenous nerve. Perfect. Tell me, who supplies the skin on the lateral aspect of the thigh? Anyone? Answer this. So medial aspect, anterior aspect is supplied by femoral nerve. Who supplies the skin on the lateral aspect of the thigh? Come on, students, come on, you can answer this. Who supplies the skin on the lateral aspect of the thigh? That's the lateral cutaneous nerve of thigh. Lateral cutaneous nerve thigh, and this is a direct branch of lumbar plexus. It's a direct branch of lumbar plexus. And there's a posterior cutaneous nerve of thigh. And this posterior cutaneous nerve of the thigh is a branch of sacral plexus. Remember, posterior cutaneous nerve of thigh is a branch of sacral plexus. Okay, so with this concept, we come back to the MCQ. So it was inferred that the knife point had severed the trunk of the right femoral nerve. Okay, right femoral nerve just below the inguinal ligament. All the following signs and symptoms are true except the right quadriceps femoris failed to contract when the patient was asked to extend the knee joint. What do you say? So, quadriceps femoris will be paralyzed, no? Because the femoral nerve supplies the quadriceps femoris, the posterior division. So, quadriceps femoris failed to contract when the patient was asked to extend the right knee joint. Yes. Skin sensations was lost on the anterior and the medial aspect of the right thigh. Correct? Yes, because that is supplied by femoral nerve. Skin sensations were lost along the medial border of the great toe. क्या बोल रहे हो बच्चों? What do you say? Is this correct? Option C, is it correct? Skin sensations are lost on the medial aspect of the great toe, medial border of the great toe. That's wrong. Skin sensations are lost on the medial aspect of the right lower leg. That's correct. ये कौन supply करता है? Saphenous nerve. This is supplied by saphenous nerve. Clear, students? So what is the saphenous nerve supply? I'll just write this down for you. What is the saphenous nerve supply? It supplies the skin. Saphenous nerve supplies the skin on medial aspect of the leg. Saphenous nerve supplies the skin on the medial aspect of the leg and the foot up to great toe. That's it. It supplies the skin on the medial aspect of the leg and the foot up to the great toe. It doesn't supply the skin on the medial aspect of the great toe. I'll just draw that for you. Ye clear hai bachcho? Is this clear to all of you? So what is the saphenous nerve supply? The skin on the medial aspect of the foot of the leg up to the great toe. Up to the great toe. Now have a look at this and tell me now, if I draw this as the foot for you, that's a foot. That's a plantar aspect of the foot. Plantar aspect. Tell me who supplies the heel. Heel is supplied by the tibial nerve. Tibial nerve. Skin or sensory supply. Who supplies the skin on the medial aspect of the foot up to the ball of the great toe. Medial aspect of the foot up to the ball of the great toe. Who's this? Saphenous nerve. So who supplies the skin on the medial aspect of the foot up to the ball of the great toe? Saphenous nerve. Now who supplies the skin on the medial aspect of the great toe? On the medial aspect of the great toe, this is the superficial peroneal nerve. Superficial peroneal nerve. Superficial peroneal. All the web spaces, students, all the web spaces are supplied by whom? All the web spaces are supplied by the superficial peroneal nerve. The first web space where we put our slippers, this one, this is supplied by whom? The deep peroneal nerve. Remember, the first web space is supplied by the deep peroneal nerve. The lateral aspect of the foot is supplied by whom? The lateral aspect is supplied by sural nerve. Sural nerve. Plenty of MCQs on this. This is supplied by sural nerve. This 3.5 fingers is supplied by medial plantar nerve. 3.5 fingers is supplied by medial plantar nerve and 1.5 fingers is supplied by lateral plantar nerve. ये जो medial and lateral plantar nerves हैं, these are branches of what? Tibial nerve. Tibial nerve. So tibial nerve divides into a medial plantar and a lateral plantar. The medial plantar supplies the skin on the plantar aspect of medial 3.5 fingers. Plantar aspect of the medial 3.5 fingers. That's medial plantar. The lateral plantar supplies the skin on the plantar aspect of lateral 1.5 fingers. This should be perfect, students. इस पर बहुत MCQs आते हैं, बहुत. You get options also in the MCQs based on this. Clear to all of you? Is this clear? So who supplies the skin of the first web space? The first web space is supplied by the deep peroneal nerve. Skin over the first web space is supplied by the deep peroneal nerve. Clear? Who supplies the lateral aspect of the foot? That is supplied by the sural nerve. The medial aspect of the foot up to the great toe, that's saphenous nerve. The skin on the medial aspect of the great toe is saphenous nerve. All the web spaces except the first is superficial peroneal nerve. I hope this is clear. Okay, I'll clear this. And just one more thing which I want you to understand. Dekho, thigh. There are 4 aspects of the thigh. Anterior aspect, medial aspect, lateral aspect, and the posterior aspect. This is the cutaneous nerve supply. We're talking about cutaneous nerve supply. So the cutaneous nerve supply of the thigh, anterior, medial, lateral, and posterior. So who supplies the skin on the anterior and the medial aspect of the thigh? Femoral nerve. That's femoral nerve. Who supplies the skin on the lateral aspect of the thigh? That's the lateral cutaneous nerve of thigh. Lateral cutaneous nerve of thigh, this is a branch of lumbar plexus. It's a branch of lumbar plexus. Students, and this nerve gets compressed against the inguinal ligament. This is the nerve which gets compressed against the inguinal ligament. What does the person complain of? Paresthesia, tingling and numbness along the lateral aspect of the thigh, and this is what we call as meralgia paresthetica. Correct? This is what we call as meralgia paresthetica. And posterior aspect of the thigh is supplied by it's the posterior cutaneous nerve of thigh, which is a branch of sacral plexus. Perfect. Is this clear to all of you? Okay, now we go to the next MCQ. Now see this, एक बार वापस देख लो ये MCQ and just try to understand. So answer would be C from this. C. Skin along the medial aspect of the great toe, that is supplied by superficial peroneal nerve. Superficial peroneal. Is this clear? Okay, we go to the next MCQ then. Answer this. A person met with an accident. He had a fracture on the base of the skull. Upon regaining consciousness in the hospital, he notices that he cannot move the muscles on the right side of the face, leading to drooling and dry eye on that side. Further testing by his neurologist indicates that the motor component of the facial nerve on the right side is not functional, although lacrimal secretions, submandibular secretions and taste are intact. This suggests that the nerve was severed as it passes through. Answer this. Come on, come on, come on, come on, students. Any guesses? Any guesses? So we'll just discuss the facial nerve in short. Tell me, students, now facial nerve enters into which foramen of the skull? Into which foramen does the facial nerve enter? The internal acoustic meatus. Correct? It enters into the internal acoustic meatus. It's now inside which ear? The facial nerve enters into the internal acoustic meatus. It is into which ear? Internal ear. From the internal ear, it comes into the middle ear cavity. And as it, see, I'll just make something for you. From the internal ear, the facial nerve comes in the middle ear cavity. I'm drawing this as the middle ear cavity for you. What is this elevation on the medial wall of middle ear? What's that? Promontory. The elevation on the medial wall of middle ear is known as promontory, and on this promontory we got a plexus here. What is a plexus lying on the promontory? Known as the tympanic plexus. Now the facial nerve, the facial nerve enters the middle ear like this. It enters the middle ear cavity. Now it undergoes a bend here. What is this bend? Known as genu. The facial nerve enters the middle ear, undergoes a bend, that's a genu, now goes above the promontory. It goes above the promontory. Now it again undergoes a bend here. Again the second genu. Now it goes behind the promontory. And it gets out through, it goes behind the promontory, it gets out through the stylomastoid foramen, and it enters into the parotid gland. And use this 5 branches. अब ये 5 branches देखा parotid में. This we know. So the facial nerve enters into the internal acoustic meatus. अब ये कहाँ है? Where is it now? Into the middle ear. It undergoes a bend. That's a genu. Goes above the promontory. Undergoes a second bend. The second genu goes behind the promontory. Gets out through the stylomastoid foramen. Enters the parotid. Gives 5 branches. In the ear, the facial nerve gives 3 branches. It gives 3 branches. One is the greater petrosal nerve. Second is the nerve 2 stapedius, and the third one is chorda tympani. Okay, so greater petrosal, the nerve 2 stapedius, and chorda tympani. Tell me now, students, what does the chorda tympani nerve do? I mean, what does it supply? It supplies taste sensations. I'll just mention this for you. Taste sensations to anterior 2/3 of the tongue. Taste sensations on the anterior 2/3 of the tongue. The nerve 2 stapedius supplies the stapedius. What else does the chorda tympani do? It carries secretomotor fibers to submandibular gland and sublingual gland. Secretomotor fibers to the submandibular and the sublingual gland. So what does the chorda tympani have? It has 2 types of fiber. One is the taste fiber, which supplies the anterior 2/3 of the tongue. The taste fiber supplying the anterior 2/3. It also has secretomotor fibers to supply the submandibular and the sublingual glands. So if the chorda tympani nerve is injured, chorda tympani is given by the facial nerve in the middle ear, correct? The chorda tympani gets out of the ear through which foramen? Can anyone tell me this? The chorda tympani gets out of the ear through which foramen? Yes, students, come on. Answer this MCQ. The chorda tympani gets outside the ear through which foramen? That's the pituotympanic fissure. It gets out through the pituotympanic fissure. It goes and joins with the lingual nerve, and then it goes to the submandibular ganglion. Correct? We know this. So what does the chorda tympani do? It carries taste sensations from the anterior 2/3 of the tongue. It also carries secretomotor fibers to supply the submandibular and the sublingual glands. So if the chorda tympani nerve is injured, if there's a lesion of chorda tympani, so what will happen? There will be loss of taste sensations, loss of secretions from the submandibular and the sublingual glands. What does the nerve to stapedius supply? It supplies the stapedius. It supplies the stapedius. And what is the greater petrosal nerve supply, students? The greater petrosal nerve supplies this, the lacrimal, nasal, palatine, and pharyngeal glands. Lacrimal, nasal, palatine, and pharyngeal glands. Okay, so the greater petrosal nerve supplies the lacrimal, nasal, palatine, and pharyngeal glands. Clear to all of you? So these are the three branches of the facial nerve in the middle ear. Now the facial nerve gets out through what? It gets out through the stylomastoid foramen, enters the parotid gland, and then gives 5 branches. So students, now tell me, if there's a lesion of facial nerve here, we'll start. If there's a lesion of facial nerve right here, I put this as number 1. At the stylomastoid foramen, if the facial nerve is injured, what will the person complain of? Bolo. Answer this. Students, answer this. If the facial nerve is injured at the stylomastoid foramen, what will the person complain of? The person will complain of Bell's palsy. Bell's palsy, it's a locomotor neuron lesion. So the entire half of the face muscles would be paralyzed. Entire half of the face muscles would be paralyzed. So this is Bell's palsy. If there's a lesion of facial nerve here, just above the chorda tympani, just above the chorda tympani, the person will have 1, Bell's palsy. The person will have Bell's palsy. Second, the person will have loss of taste sensation, loss of secretions from the submandibular and sublingual glands. Perfect. If the nerve is injured here, if the facial nerve is injured here, in addition to all this, the person will have hyperacusis. And if the facial nerve is injured here, just after the genu, so all the branches of facial nerve are gone. The greater petrosal gland, nerve to stapedius gone, the chorda tympani gone, as well as the muscles of the face, the muscles of second pharyngeal arch are paralyzed. Okay, so there will be a loss of secretions from all the glands except parotid. Because parotid is supplied by which nerve? Glossopharyngeal nerve. Is this clear, students? I hope this is clear. And when there's a lesion of facial nerve above the geniculate ganglion, a high lesion of facial nerve, it's a very high lesion of facial nerve. अब जब regeneration होता है, when there's a regeneration going on, the fibers going to the lacrimal gland, gets mixed. There's a mixing of fibers. The fibers gets mixed with the submandibular and sublingual glands. Okay, so the fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular and sublingual glands, resulting when a person salivates, the person starts to get tears. And this is what we call as crocodile tears. This is clear to all of you? Phrase syndrome nahi hai bacha. This is not phrase syndrome. When there's a lesion of facial nerve, high lesions of facial nerve. So when the regeneration is going on, there's a mixing of fibers. The fibers going to the lacrimal gland gets mixed with the fibers going to the submandibular and sublingual glands. And now when a person salivates, the person starts to get tears. And this is what we call as crocodile tears. Can anyone tell me? Sukha, what is phrase syndrome? You answered phrase syndrome. Tell me what is phrase syndrome. Anyone? Can anyone tell me what is phrase syndrome? So, एक बेटा, crocodile tears, that's an MCQ. Crocodile tears involves which two glands? Involves lacrimal and submandibular glands. Now, what is phrase syndrome? Phrase, yes, because gustatory is waiting. So, when there's a lesion of the skin over the parotid gland, when there's a perforating lesion of the skin over the parotid gland, now when regeneration takes place, there's a mixing of fibers between two nerves. There's a mixing of fibers of two nerves. The fibers of auriculotemporal nerve gets mixed with the fibers of greater auricular nerve. Fibers of auriculotemporal nerve gets mixed with the fibers of the greater auricular nerve. So students, if you can tell me what is the auriculotemporal nerve supply? No, it doesn't supply. Auriculotemporal nerve just carries the fibers to the parotid gland. It just carries the fibers to the parotid gland. And what is the greater auricular nerve supply? The greater auricular nerve supplies, yes, it supplies this skin over the parotid. It also supplies the sweat glands. So when there's an injury here, there's a mixing of fibers between the auriculotemporal nerve and the greater auricular nerve. So when a person salivates, the person starts to get sweating of the skin over the parotid gland. Okay, when the person salivates, the person starts to get sweating, and this is what we call as Frey's syndrome. I hope this is clear. Yes, very good, very good. So I will explain you the complete facial nerve, students. I hope this is clear to all of you. What is this promontory? That's an elevation on the medial wall of middle ear. And if you can quickly tell me, how is this? There's someone lying on the promontory. Students, there's someone lying on the promontory like this. Yes, there's a plexus of nerves. Can anyone tell me what is this plexus known as? There's someone lying on the promontory. And what is that plexus of nerves known as? The tympanic plexus. Tympanic plexus. Okay, so there's a plexus which lies on the promontory, and that is known as tympanic plexus. This tympanic plexus belongs to which nerve? Answer this. This tympanic plexus belongs to which nerve? Students, come on. Tympanic plexus belongs to which nerve? Yes, Karthik. Glossopharyngeal nerve. It belongs to the glossopharyngeal nerve. You know this, no? It belongs to the glossopharyngeal nerve. Tympanic plexus belongs to the glossopharyngeal nerve. Okay. And from this tympanic plexus, you get a nerve. What is that nerve known as? Okay. Just have a look. That's an inferior salivatory nucleus. That's a nucleus of glossopharyngeal nerve. It's tympanic branch. You must be knowing this. Tympanic branch of glossopharyngeal nerve. What is the name for this? Tympanic branch of glossopharyngeal nerve is known as Jacobson's nerve. Jacobson's nerve. It joins with the sympathetic plexus. Tympanic branch of glossopharyngeal nerve, that's the Jacobson's nerve. It joins with the sympathetic plexus and forms the tympanic plexus. Now, where does this tympanic plexus lie? Students, this tympanic plexus lies on the promontory of the middle ear. It lies on the promontory of the middle ear. From this tympanic plexus, we get a nerve. What's that? Lesser petrosal nerve. Where have you heard this nerve, students? Yes, we have heard this nerve comes out through the foramen ovale, right? So the lesser petrosal nerve gets out through the foramen ovale, release in otic ganglion. And the fibers would now supply the parotid gland. The fibers now supply the parotid gland. So what are these fibers from the brainstem to this ganglion? What are these fibers? These are the pre-ganglionic fibers. And what are these fibers? These are the post-ganglionic fibers. Pre-ganglionic fibers, post-ganglionic fibers. And now who's going to carry this post-ganglionic fibers? These post-ganglionic fibers are carried by the auriculotemporal nerve. Auriculotemporal nerve. Is this clear? So these are the post-ganglionic fibers. ये मैं बोल रहा हूँ आपको. Auriculotemporal nerve as such does not supply the parotid. Students, remember, it just carries the post-ganglionic fibers to the parotid gland. And this fibers of auriculotemporal nerve gets mixed with the greater auricular nerve, which also supplies the sweat gland. And that is how when a person salivates, the person starts to get sweating. And that is Frey's syndrome. Okay, perfect. I hope this is clear to all of you. Right, just have a look at this MCQ once again. I hope this is clear. अगर कुछ doubt है तो बोलो. See, lacrimal secretion is intact, submandibular secretion is intact, taste is intact. Matlab chorda tympani is intact, greater petrosal nerve is intact, right? And hearing will also be intact. So where is the nerve injured? At the stylomastoid foramen. So if the facial nerve is injured at the stylomastoid foramen, the person gets what? Bell's palsy. Bell's palsy. Tell me, what are the structures which enters the internal acoustic meatus? The 7th nerve, the 8th nerve, 7th nerve, 8th nerve, and the labyrinthine artery. 7th nerve, 8th nerve, and the labyrinthine artery. Clear? Enters the internal acoustic meatus. 7th nerve, 8th nerve, and the labyrinthine artery. Stylomastoid foramen fissure. The petrotympanic fissure, who exits out? The chorda tympani. Petrotympanic fissure, the nerve which emerges out is chorda tympani. Foramen spinosum. Students, can you answer this? What passes through foramen spinosum? Foramen spinosum. What passes is the nervus spinosus and middle meningeal artery. Nervus spinosus and the middle meningeal artery. This nervus spinosus is also known as what? The meningeal branch of mandibular nerve. The nervus spinosus is known as meningeal branch of mandibular nerve and the middle meningeal artery. Perfect, very good. Okay, with this we go to the next MCQ, students. I hope this is clear to all of you. Yeah. Identify this pointed structure. Identify this pointed structure. This is a very important visual slide, students. A very important visual slide. Identify this pointed structure. The one blue. Yeah, this one, this blue arrow. Na? Any guesses? Yes, very good, Arundhati. That's the spinal accessory nerve. Correct. That's the spinal accessory nerve. And this spinal accessory nerve lies on a muscle here. Can anyone tell me what is this muscle on which the accessory nerve lies? What is that muscle? Guess. The spinal accessory nerve lies on, yes, the levator scapulae. That's a very important MCQ. It lies on the levator scapulae. Okay. What is this triangle of the neck that we're looking at? What is this triangle of the neck here? That's a posterior triangle of the neck. And a very, very, very important content of the posterior triangle is spinal accessory nerve. And this nerve is very superficial. It is very superficial. It lies on what? The levator scapulae. The nerve is very superficial. It lies on the levator scapulae. And why is this so important? Because in the posterior triangle of the neck, we get large number of lymph nodes. There are plenty of lymph nodes here. And this lymph nodes becomes matted in tuberculosis. This lymph nodes becomes matted in tuberculosis. So now when you are going to remove a lymph node, when we remove a lymph node, or if there's an abscess, if you are draining an abscess in the posterior triangle, the spinal accessory nerve gets damaged. Students, you tell me, if the spinal accessory nerve is damaged in the posterior triangle of the neck, which is the muscle? Paralyzed. If the spinal accessory nerve is damaged in the posterior triangle of the neck, the muscle paralyzed is or are? Answer, come on. See, because spinal accessory nerve, we know it supplies two muscles. One is the trapezius and one is sternocleidomastoid. So which is the muscle paralyzed? Trapezius. Why not sternocleidomastoid? Not sternocleidomastoid. Is it only trapezius? Are you confident? Sternocleidomastoid. You should be confident. You should be confident. See, spinal accessory nerve क्या supply करता है? It supplies the sternocleidomastoid as well as the trapezius. But the spinal accessory nerve first supplies the sternocleidomastoid. Get this point, students. Get this very clear. The spinal accessory nerve first supplies the sternocleidomastoid, then and only then it comes in the posterior triangle of the neck. It lies on what? Levator scapulae, and it goes to supply the trapezius. And that's how, when the spinal accessory nerve is damaged in the posterior triangle, the muscle paralyzed is only trapezius. This should be very clear. The muscle paralyzed is only trapezius. Sternocleidomastoid is intact. It's intact because it has already been supplied. It has already been supplied. So sternocleidomastoid is intact. So which movement is intact? Rotation of the neck. Rotation of the neck is intact. Clear? Rotation of the neck is intact. So who's paralyzed? Trapezius. Tell me, what will the person complain of? Yes, very good. Very good to all of you. Nice, good. So what will the person complain of? Trapezius is paralyzed. So there's difficulty in shrugging of shoulders, right? There's difficulty in shrugging of shoulders. Second, there's difficulty in overhead abduction of arm. Difficulty in overhead abduction of arm. And third, there is winging of scapula. Winging of scapula at rest. At rest. But when the arm is at rest, there's winging of scapula. Winging of scapula at rest. This is clear to all of you. So trapezius is paralyzed. What will the person complain of? One, difficulty in shrugging of shoulders. Second, difficulty in overhead abduction. And third, winging of scapula at rest. At rest. Is there something like winging of scapula on attempting movement? ऐसे कुछ होता है? Is there something like that? Winging of scapula on producing a movement, on attempting a movement. Who's the muscle paralyzed? If there's winging while attempting a movement, which is the muscle paralyzed? Come on, students, answer this. Sternocleidomastoid. That's I'm so sorry. That's serratus anterior. I'm so sorry. Serratus anterior. So winging on attempting movement, serratus anterior, and winging at rest, trapezius. Be very clear. So a person comes to your clinic and you find there's a winging of scapula. What do you tell the person to do? You tell the person to go to the wall and push the wall. And now if there's a winging, yes, this is due to paralysis of serratus anterior. And if the person is just sitting and there's still a winging, that's due to paralysis of trapezius. Okay, fine. I hope this is clear. Answer this. What is this structure? Students, what is this structure? This is a very important visual slide for you. So what is this structure? This has to be vagus nerve, correct? This has to be vagus nerve, and this vagus nerve lies in a sheath here. What is that sheath known as? Carotid sheath. The vagus nerve lies in the carotid sheath, which consists of the internal jugular vein, the internal carotid artery. That's the vagus nerve. Vagus. What is this nerve? Can anyone tell me what is this nerve? You can see this now, students. What is this nerve? This is the phrenic nerve. ये होगा phrenic nerve. And this phrenic nerve lies on a muscle here. What is this muscle on which the phrenic nerve lies? That's the scalenus anterior. That's the scalenus anterior muscle. And the phrenic nerve lies on the scalenus anterior. Phrenic nerve lies on the scalenus anterior. Perfect. This is the scalenus anterior, and this scalenus anterior is crossed by two arteries. Can anyone tell me what are these two arteries which are crossing the scalenus anterior? What is this artery? I'll just clear all this. What is this artery? What is this artery which is crossing? And what is this artery which is crossing the scalenus anterior? This is the... any guesses? Any guesses? What are these two arteries which cross the scalenus anterior? This is going transversely in the neck. This is the transverse. You have to know this, transverse cervical artery. Transverse cervical artery, and this one is the suprascapular artery. Transverse cervical artery and the suprascapular artery. This one. This is a transverse cervical and that's a suprascapular. Both these arteries are going to cross the scalenus anterior. Both these arteries are going to cross the phrenic nerve. Phrenic nerve. What is this now, students? What is this? That's a brachial plexus. That's a brachial plexus. What artery is this? Can you see this? What is this artery here? That's a brachial plexus. A posterior triangle है. So which part of the brachial plexus is this? The supraclavicular part. The supraclavicular part. That's a subclavian artery, and that's a subclavian vein here. So what is this cutaneous anterior going to separate? It separates the subclavian vein from the subclavian artery. The vein from the artery. These are the strap muscles here, students. These are the strap muscles. And all the strap muscles are supplied by ansa cervicalis. Clear? All the strap muscles are supplied by ansa cervicalis except, come on students, come on, fill in the blanks. All the strap muscles are supplied by ansa cervicalis except, can anyone answer this? Except. I'm waiting. All the strap muscles are supplied by ansa cervicalis except, yes, the thyrohyoid. And this thyrohyoid is supplied by whom? C1. Thyroid is supplied by C1. Okay. Can anyone tell me what is this nerve? ये क्या nerve है? Any guesses? Thyroid. Okay, that's thyrohyoid. All the strap muscles कौन है? Sternohyoid, sternothyroid, omohyoid, and thyrohyoid. Sternohyoid, omohyoid, sternothyroid, and thyrohyoid. Out of all this, the thyrohyoid is not supplied by ANSA. The thyrohyoid is supplied by C1. This is perfect, students. Perfect. Tell me, what is this structure? What is this structure? What is this structure? Come on, students, answer. Be quick. ये है hypoglossal nerve. That's a hypoglossal nerve. Okay, that's a hypoglossal nerve. And this hypoglossal nerve is going now to supply the tongue. That's going to supply the tongue. What is this muscle? Yes, some visuals, students. These are all very important visual slides. Be clear about this. What is this muscle? Any guesses? This is the stylohyoid. ये है stylohyoid. If that's the stylohyoid, what is this muscle? This is going to be the posterior belly of digastric. Posterior belly of digastric. Stylohyoid, and that's the posterior belly of digastric. Correct? Both of this are supplied by which nerve? Stylohyoid and the posterior belly of digastric both are supplied by facial nerve. Facial nerve, because they lie in the second pharyngeal arch. They lie in the second pharyngeal arch. Clear? Okay, that's it. What is this artery? That's a facial artery. And what is this muscle against which we feel for the facial artery? That's a masseter. Okay, fine. Answer this. Come on, students. A chronic alcoholic was diagnosed with a pseudocyst of pancreas. The pancreas is a retroperitoneal organ. All the following statements about pancreas are true except option 1. Tail contains maximum islets of Langerhans. True or false? Is this true or false? Tail contains the maximum islets? Yes. The tail contains the maximum islets of Langerhans, and this tail of pancreas lies in which ligament? Students, if you can answer this, the tail of pancreas lies in which ligament? The linorenal ligament. The linorenal ligament. And when we are doing a splenectomy, when we are removing a spleen, when we do a splenectomy, we have to cut these two ligaments, the gastrosplenic and the linorenal ligaments. And when we are cutting the linorenal ligament, we have to be very careful to preserve the tail of the pancreas. Because this tail contains the maximum islets of Langerhans. Clear? And if we cut the tail, the person goes into diabetes. Now tell me, which part of the pancreas is more prone to cancer? The head of the pancreas. And if there's a C of the head of the pancreas, who's compressed bile duct, what does a person get? Obstructive jaundice. So head is more prone to cancer. The tail contains the maximum islets. Okay, so this is correct. Tail contains the maximum islets. Right crus of the diaphragm is related to the head posteriorly. क्या बोलते हो? Is this correct, students, or wrong? The right crus is related to Okay, right. I've got a look at this now, students. I draw this as the IVC. IVC. What is this now? That's the right renal vein, and that's the left renal vein. Right and left renal vein. What is this going to be? That's the right kidney. Right kidney. What is this structure here? That's the second part of the duodenum. That's the second part of the duodenum. And who would be lying here now? Who would be lying here? This would be the head of the pancreas. That's the head of the pancreas. The head of the pancreas lies here. So now you tell me, students, what is the posterior relations of the head of the pancreas? One is the IVC. Second is the right renal vein. Right renal vein. Third is the right crus of the diaphragm. Right crus. And the fourth is a duct. Students, can you tell me what is this duct which is opening in the second part of the duodenum? That's the bile duct. Bile duct. So what are the posterior relations of the head of the pancreas? Posterior relations of the head. IVC, the right renal vein, right crus of the diaphragm, right crus of the diaphragm, bile duct. Okay, so this becomes the posterior relations of the head of the pancreas. Head. One is the IVC, second is the right renal vein. So one is the IVC, second is the right renal vein, third is the right crus, and fourth is the bile duct. Is this clear, students? Is this clear? So that yellow structure I've drawn as the head of the pancreas. Dikh raha hai na ye? You can see this one. Okay, so that's perfect. Be very clear, इस पे बहुत MCQs हैं. Posterior relations of the head of the pancreas. One is the IVC, the right renal vein, the right crus, and the bile duct. Can anyone tell me what are the anterior relations of the head of the pancreas? Can anyone? Anterior relations of the head of the pancreas. Someone crosses the pancreas here. That's the transverse colon and mesocolon. So anterior relations of the head of the pancreas is going to be the transverse colon and mesocolon, and the first part of duodenum. The first part of duodenum. Okay. Coming back. So right crus of the diaphragm is posteriorly related to the head. Yes. Splenic artery supplies the pancreas. What do you say, students? Splenic artery, it supplies the pancreas. Barabar hai na? Yes, the splenic artery supplies the pancreas. Okay, if that's a duodenum here, that's a duodenum, and that's the pancreas. That's a spleen. What is this artery which runs on the superior border of the body of the pancreas? That's a splenic artery. The splenic artery gives branches to the pancreas. What are these branches known as? What do you call these branches to the pancreas as? The pancreatic branches. This is what we call as the pancreatic branches. There are many pancreatic branches. There are many pancreatic branches, out of which one is large. One artery is large, and this is what we call as the arteria. Pancreatica magna. Arteria pancreatica magna. Okay. So the splenic artery runs on the superior border of the body of pancreas, gives branches to the pancreas. These are the pancreatic branches. One of the arteries is large. That's the arteria pancreatica magna. It gives branches to supply the fundus, the short gastric branches, and it gives branches to supply the greater curvature of the stomach. What is this? This is the left gastroepiploid artery. Left gastroepiploid artery. And what are these? These are the short gastric arteries. Short gastric artery is the left gastroepiploid artery, and this is the splenic artery. Splenic artery. Superior and inferior pancreatico-duodenal arteries supply to, yes, they supply the duodenum as well as the pancreas. The superior pancreatico-duodenal supplies the duodenum up to the opening of bile duct. Up to the opening of bile duct, because this part of the duodenum is derived from what? Foregut. Duodenum is partly derived from foregut, partly derived from midgut. So duodenum has a dual blood supply. So the part of the duodenum above the opening of bile duct is derived from foregut. So it is supplied by the superior pancreaticoduodenal artery, which belongs to the celiac trunk. The inferior pancreaticoduodenal artery supplies the duodenum below the bile duct. This is a branch of superior mesenteric. They also supply the pancreas. Okay. But it is specifically said, no, splenic artery. इसमें क्या दिया देखो ना. The splenic artery supplies the pancreas. That's correct. The uncinate process drains via the accessory pancreatic duct into the duodenum. What do you say? Is this correct? Is this correct? The uncinate process drains via the accessory pancreatic duct into the duodenum. Okay, I'll just draw this for you. Look up. ये duodenum है. That's the pancreas. That's the uncinate process of pancreas. ये किसका duct है? बोलो students. What is this duct of? This is the duct of dorsal bud. This is the duct of dorsal bud. And what is this duct of? This is the duct of ventral bud. Ventral bud. What is the dorsal bud of the pancreas? दो buds होता है ना pancreas के. One is the dorsal pancreatic bud. One is the ventral pancreatic bud. What does the dorsal pancreatic bud form? It forms the upper part of the head, the neck, the body, and the tail of the pancreas. Correct? The dorsal pancreatic bud forms the upper part of the head, neck, body, and tail of the pancreas. What does the ventral pancreatic bud form? It forms the lower part of the head and the uncinate process. The ventral pancreatic bud forms the lower part of the head and the uncinate process. So what is this? ये clear है? This is a very important MCQ. The dorsal, I'll just mention this for you. Dorsal pancreatic bud forms what? The upper part of the head. Upper part of the head. Everything is foregut. Spleen actually is a collection of lymphoid follicles, collection of lymphoid tissue that develops in the dorsal mesogastrium. Dorsal mesogastrium, but it is said to be derived from foregut. Upper part of the head, neck, body, and tail of the pancreas is derived from dorsal bud. And the ventral pancreatic bud forms what? The lower part of the head. I'll write here. Ventral pancreatic bud forms what? The lower part of the head. Lower part of the head and uncinate process. The ventral pancreatic bud forms the lower part of the head and the uncinate process. अब ये किसका duct है? This is the duct of dorsal bud. This is the duct of ventral bud. Okay. How's the main pancreatic duct formed? The main pancreatic duct is derived from the duct of the dorsal bud, the duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. The duct of the dorsal bud, the duct of the ventral bud, and the anastomosis between them. This is the main pancreatic duct. Main pancreatic duct. So the main pancreatic duct is derived from the duct of the dorsal bud, duct of dorsal bud, ventral bud, and anastomosis between them. So the duct of dorsal bud, ventral bud, and the anastomosis between them. That's the main pancreatic duct. And what is the accessory pancreatic duct derived from? The accessory pancreatic duct is derived from the duct of dorsal bud. Accessory pancreatic duct is derived from the duct of dorsal bud. I hope this is clear. Accessory pancreatic duct is derived from the duct of the dorsal bud. And the main pancreatic duct is derived from the duct of the dorsal bud, ventral bud, and the anastomosis between them. What is the main pancreatic duct known as? Students, can you answer this? The main pancreatic duct is known as what? The duct of Wirsung. The main pancreatic duct is known as the duct of Wirsung, and where does it open? At the major duodenal papillae. Major duodenal papillae. And where is the accessory? What is the accessory pancreatic duct known as? The duct of Santorini. The accessory pancreatic duct is known as the duct of Santorini. And where does it open? In the minor duodenal papillae. Minor duodenal papillae. Okay. So the main pancreatic duct opens at the major duodenal papillae. The accessory duct opens in the minor duodenal papillae. Is this clear, students? Perfect. Clear to all of you? No confusion in this. This is a very important MCQ. But normally क्या होता है, dorsal bud है, ventral bud है. The ventral bud migrates and joins with the dorsal bud. The ventral bud migrates and joins with the dorsal bud. But sometimes half of the ventral bud migrates from behind, half of the ventral bud migrates from front, and this type of pancreas is going to encircle the duodenum. What do we call this as? Annular pancreas. This is what we call as annular pancreas. So annular pancreas occurs due to defective migration of, answer this. Annular pancreas occurs due to defective migration of ventral pancreatic bud. Ventral pancreatic bud. Annular pancreas occurs due to defective migration of ventral pancreatic bud. Sometimes this ventral bud does not fuse with the dorsal bud. If the ventral and the dorsal bud does not fuse, we get a divided pancreas. This is a divided pancreas, and this is what we call as a pancreatic divisum. Pancreatic divisum. So pancreatic divisum is due to non-fusion of the two pancreatic buds. Non-fusion of the two pancreatic buds. That's pancreatic divisum. Is this clear to all of you, students? Any doubts? Yes, very good, Arundhati. And all of you have answered very well. Very good interactive session. Yes, good, good. Okay, just one slide I'll show you. Or just one moment. Before I come to the slide, let me brief about our platform, because there are many new things which are starting here, students, for you. There's a plus subscription in which with their daily live classes, live quizzes, learn from the top educators, study from the device of your choice, and now you can also access our question bank. An iconic subscription where you get the best of Unacademy and pre-platter. Okay. Then we've started Unacademy Lite. This is a test series for the NEET PG students. We have already started with the first prof, MBBS first prof. We have launched a daily practice test papers. Okay, after every special class. We've started with a doubt clarification batch, especially for you students. These are our FMG toppers who've got very good ranks in the recent health exams. So some special class features in which there are daily live classes, live quizzes, poll for the learners, raise a hand technique. If you press the icon, you can directly talk to the educator. Never miss a class because you get proper notifications. And if you miss it, you get lecture notes in the form of PDF. So anywhere, anytime you can access the class and get your doubts solved. So starting with NEET PG 2022, all educator revision batch. So all the educators of Unacademy under one roof, especially for you students, the final touches. So April 20th, download the Unacademy app and subscribe to it. We are also starting with the foundation batch. So boost your medical preparation, students. 12 months you get 2 months free, 24 months 4 months free, and 36 months you get 6 months free. So download the Unacademy app and subscribe to it. Okay. Just one moment. I'll just show you one last slide before we stop for the day. Chalo, answer this. Structure. Answer this. The one in blue. The one pointed in blue, students. The one pointed in blue. Any guesses? What is this section of the brain? That's a horizontal section. That's a transverse section or a horizontal section of the brain. Now this is what? What is this? This is the corpus callosum. That's the septum pellucidum. That's the fornix. You can see this. This is a corpus callosum, septum pellucidum, fornix. That's the lateral ventricle. That's the lateral ventricle. So what is this? This is a caudate nucleus. Caudate nucleus. What is this? This is the thalamus. Caudate nucleus, thalamus. What is this? This is the lentiform nucleus. Lentiform nucleus. What is this V-shaped structure? This is the internal capsule. Internal capsule. Okay. So that's the caudate nucleus. That's the lentiform. That's the caudate nucleus. That's the thalamus. That's the lentiform nucleus. This is the V-shaped structure. That's the internal capsule. Internal capsule, correct? What is this limb of the internal capsule? Anterior limb. What is this bend known as? Genu. That's the genu. What is this for the internal capsule? That's a posterior limb. Posterior limb. This part goes behind the lentiform nucleus. What do you call this as? The retrolentiform part. Retrolentiform part. And the part goes below the lentiform nucleus. Yes, that's the sublentiform part of internal capsule. So anterior limb, this is the genu, that's the posterior limb. This part would be the retrolentiform part, and the part below the lentiform nucleus is the sublentiform part. Students, can you tell me the corticonuclear fibers pass through which limb of the internal capsule? Corticonuclear fibers pass through which limb of the internal capsule? Any guesses? You can guess, students. Corticonuclear fibers pass through. Yes? Genu. Very good. Yes, Rajesh. Very good. Corticonuclear fibers pass through the genu of the internal capsule. The corticospinal fibers pass through. Very good to all of you. Corticospinal fibers pass through posterior limb. Corticospinal fibers pass through the posterior limb of the internal capsule. Can anyone tell me the optic radiation passes through what? The optic radiation passes through retrolentiform part. This is going to the occipital lobe. This is going to the visual cortex. So the optic radiation concerned with visual pathway, the optic radiation passes through which limb of the internal capsule? Your answer would be the retrolentiform part. And one last thing, the auditory radiation passes to which limb of the internal capsule? The auditory radiation is supposed to go to the temporal lobe. So it will go below the lentiform nucleus. So which is that part of the internal capsule, the fibers which pass below the lentiform nucleus, that's the sublentiform part. So the sublentiform part passes below the lentiform nucleus. It goes below the lentiform nucleus. That's it. So the auditory radiation passes through the sublentiform part. Okay, I hope students everything is clear to you, and thank you for a very interactive session. Thank you to all of you once again. It was a very interactive session, and I hope many concepts are clear to you in this session. Okay, I stop here. Have a good day. Any doubts anyone has? Any doubts anyone has? Any doubts anyone has? Okay, thank you. Thank you to all of you. Thank you. I'll stop here. Thank you.